Hello, my name is Muhammad Hazrul. Today I would like to present about when EYESTALK ablation should be done. So firstly, it can be done during the broodstock conditioning stage. For example, after shrimp reach sexual maturity size. For white-leg shrimp, Itopeneus paname, for female, body weight is 30 to 40 gram and its body length is 15 to 70 centimeter, while for male its body weight 25 to 30 gram and body length is 13 to 15 centimeter. So when broodstock have a complete, so we can do the acclimatation, give it a good nutrition, for example high protein diet and stable water parameter in broodstock tank. The purpose of this, we want to increase the ovarian maturation rate and spermatophore quality for hatchery seed production. At the next slide, we can see the why is timing is matters, because EYESTALK ablation contain the X organ, which is sinus gland, very complex, which secretes hormone that inhibiting maturation, for example MIH, GIH, and MOIH, which is MIH refers to molting inhibiting hormone, GIH gonad inhibiting hormone, and MOIH mandibular organ inhibiting hormone. So, because the gonads are reacting to hormone withdrawal, ablation is only successful when prawn attain sexual maturity size. The indicator for ablation, we must check the female ovarian stage, whether it at the second or third stage, which is show the greenish or yellowish ovaries visible, and reach the targeted body weight. While for male, it's spermatophore fully developed and white, while petasma are fully developed and no external injuries at the shrimp or prawn. So the risk when it done too early or too late, if we done too early, it can cause high mortality with broodstock and poor gonad response. For too late, it can reduce the egg quality and delay the maturation. And another factor is stress and poor environment can cause the low spawning rate success. The preparation for ablation, we should consider the shrimp or prawn to fasting at least 6 to 12 hours and reducing the handling stress, while we can also add the antiseptic to all tools before we done the EYESTALK ablation process, and we put the shrimp at the anesthetizing condition, and after post ablation care we can transfer it to the recovery tank for quarantine, and we use the antibiotic or iodine bed to remove the bacteria or pathogen. So we can also provide the low light and less disturbance to the broodstock. We don't to bother them, and give high protein maturation diet that give a good recovery for the broodstock. And lastly, regularly monitor for infection or molting process.
I will be presenting on a commonly used productive manipulation technique in shrimp aquaculture, known as EYESTALK ablation. This technique plays an important role in enhancing the reproductive performance of female broodstock, especially in commercial hatcheries. In this presentation, I will explain what EYESTALK ablation is, the biological mechanism involved, and the general methods used to perform the procedure. EYESTALK ablation refers to removal or destruction of one stalk in a female shrimp broodstock. The primary purpose on this procedure is to reduce the level of gonad inhibiting hormone or GIH, which is naturally produced within the eye stalk. When GIH levels decrease, ovarian maturation is accelerated, allowing the broodstock to reach reproductive readiness more quickly. This makes the technique widely used to improve egg production in hatcheries. Next, biologically, the eye stalk contains the X organ sinus gland complex, an important neuroendocrine system that produces GIH. GIH normally functions to suppress gonadal maturation. Therefore, as long as this hormone remains high, oocyte development is inhibited. Once eye stalk ablation is performed, the production of GIH drops significantly. This reduction stimulates vitellogenesis, promotes oocyte development, and ultimately leads to faster ovarian maturation compared to natural conditions. There are several general methods used in eye stalk ablation. The first method is mechanical ablation, where the eye stalk is physically cut and removed. While simple, this technique can cause more bleeding and stress. The second method is cauterization, which uses heat to destroy the eye stalk tissue. This method results in less bleeding and provides a cleaner wound. The third method is unilateral ablation, where only one eye stalk is removed. This is the most commonly recommended method because it effectively reduces GIH while minimizing stress and mortality. Lastly, bilateral ablation, where both eye stalks are removed, is rarely used. This method causes extremely high stress and high mortality rates, making it unsuitable for modern hatchery practice.
My name is Amanda. My metric number is BS23110163, and now I will be talking about what happens biologically to the crustaceans after eye stalk ablation. So the first step in this is the eye stalk ablation, which is the trigger. Eye stalk ablation removes the X organ sinus gland complex, the major neuroendocrine system in crustaceans. This procedure is used in aquaculture to artificially stimulate rapid reproductive maturation. Then comes the loss of inhibitory hormones. The eye stalk produces several inhibitory hormones, most importantly MIH, molt inhibiting hormone, and GIH, gonad inhibiting hormone. Removing the eye stalk eliminates these hormonal breaks, causing downstream endocrine pathways to activate. Next is the activation of reproductive pathways. With inhibitory signals gone, the brain and thoracic ganglia release more gonad stimulating hormones. This shifts the endocrine balance toward reproduction, initiating vitellogenesis and ovarian development. Then comes the early gene activation. The sudden hormonal change triggers rapid activation of genes involved in reproduction, including those regulating yolk formation, lipid transport, and ovarian growth. These early response genes set the stage for accelerated maturation. Then comes the vitellogenin upregulation. Vitellogenin, the precursor to egg yolk protein, becomes highly upregulated in the hepatopancreas and hemolymph. This provides the raw material for developing oocytes and is a primary marker of stimulated reproductive activity. Then, ovarian maturation. As vitellogenin accumulates, oocytes grow quickly, leading to enlarged, mature ovaries. This results in faster spawning cycles and higher reproductive output in ablated females. Then, there will be an increase in energy demand. Reproductive processes, especially vitellogenesis, are energetically expensive. The organism's metabolic demand rises, requiring greater mobilization of lipids, proteins, and carbohydrates. Finally, there will be resource allocation. Because energy resources are finite, more energy is diverted from maintenance functions such as immunity towards reproduction. This trade off explains why eye stalk ablated animals often show weakened immune responses and higher susceptibility to stress and disease. Besides that, these are other changes that happen to crustaceans biologically after eye stalk ablation. The first one is reproductive changes. Ablated females spawn more frequently, have a higher gonadosomatic index, and produce larger oocytes. However, they experience reduced weight gain and may show signs of reproductive exhaustion over time. There may also be biochemical alterations. Ablated females have lower hemocyanin levels in hemolymph, higher total carotenoids in hepatopancreas, and altered levels of acylglycerides and cholesterol in ovaries. These changes reflect increased energy demands and altered metabolic processes. The immunity of the crustacean will also be affected. This can be seen when a cluster of genes related to immunity showed signs of depletion. This happens because after eye stalk ablation, the endocrine shift pushes energy towards reproduction, such as vitellogenesis, gonad growth. Because resources are finite, immunity gets less energy, contributing to weakened immune responses. At the same time, the loss of eye stalk neurohormones can also directly reduce immune regulation. Lastly, in terms of energy and metabolism, ablation can increase food intake and energy utilization, but it may deplete reserves in tissues like hepatopancreas and muscle, potentially affecting long-term physiological condition.
Last but not least, eye-stalk ablation remain a useful yet controversial technique in shrimp and prawn reproductive management. For future studies and commercial practices, should aim to improve or replace this strategy with more sustainable, ethical, and ecological balance approaches to ensure long-term production and responsible aquaculture development.